Okay, here we go. Oh, traffic is busy. Hello. Hi, everybody. Apparently, YouTube traffic is very busy. So here we are. Welcome. Thank you for being here, my friends. Let's start out with let's get your lipstick, lip gloss, chapstick. Let's get it on. Deodorant and spritzer because I am hot as HE double hockey sticks. Humid as anything today. I didn't get myself to the beach. I was busy, had to work and do some things, but I am so hot and irritated. Not with you, but just, you know how if you're hungry and you're hot? I ate, so I'm much better, but it's just so hot. So I got my lemon spritzer that I make, put it in the fridge. It's just water with lemon essential oils, and the beast is calm now. So I want to thank you for joining. We have a very, very special show tonight. I'm going to start my intro right now, just because we're going to have my friend, my YouTube friend. Well, I think she'd be my friend in real life, actually. But anyway, here we go. We're gonna stop this, and we're gonna get rocking and rolling.
Habib-able?
Have a bagel. Miss Have a bagel.
Miss Habib-able.
Miss habib-able?
Is habitable?
Miss habib-able.
Ooh, Miss habib-able, that's what they call me. Sometimes the heat is on and my thoughts get hazy. Just a little boob sweat and a chin hair maybe. But Miss Habib-able, you know she's unbelievable. Unbelievable. Oh, so unbelievable.
Hi. Hello. This is my frozen roller. This has nothing to do with menopause. This is called humidity hangry pause. So I have my roller. How's everybody doing? It is Monday, August 10th. Wow, we're cruising right through August, aren't we? July seemed like a long month to me. So thank you for everyone for being here. Can't wait for my special guests to come. We're starting a few minutes early. But before we get rocking and rolling, let's have a bagel. You like that, Schmoop? I have these little things from the tea. You know the tea. I drink blueberry tea. Oh, let me read this really quick. It's on the tea bag. It says, "May your head and heart speak with one voice." That's very similar to the first agreement that I did last week's book club. So, without further ado, I'd like to add, she's like an old friend to the stage. Everyone, welcome Dr. Trae. Hi.
Hi. How are you?
Good. How are you doing?
I'm doing okay. Doing okay. Yeah.
Okay. Thank you for being here.
Thank you for having me again.
Absolutely.
I appreciate it.
Do you have a little cold?
I don't. It's been a little bit of a stressful time.
Okay.
It's finals week at school, and I've been dealing with a dog with a non-healing corneal ulcer. I don't know if anybody has dealt with that. It's extremely painful. So we had like a really, really rough weekend. I don't know that my lighting is the greatest, but I've had to keep my house like as a dungeon because his eye is so sensitive. So he's laying behind me. So I have everything kind of down except for a little light in front of me. So I apologize if
you look fine. I'm sorry. I'm sorry. This has been like such a tough week. So we can go as long or as little as you want.
Oh yeah. No, we're good.
Because I think you're a Habib-able friend for life. So you always come back and whatever you feel like, we talked about things that you want to discuss, but whatever you want to get into, rate whatever you feel like we talked about, that's fine.
Okay. Yeah,
and
perfect.
Just let me know how long you want to go. It's honestly, because I can babble on forever.
Yeah. No, I can get a little long-winded as well. He's resting.
Go with whatever you need to do. Totally understand.
I appreciate it. Yeah. So it's probably on my face. I kind of wear emotions on my face. So yeah. It's just been, it's been a long weekend. Haven't gotten a lot of sleep, all that good stuff, but we've got a plan in place. So I think things will start to improve, but
okay.
I'm really happy to be here. And I know we had kind of talked about, I know it's Menopause Monday, so I definitely want to make sure we kind of stay on that focus. And, I had thought about it. And there's two things that really I feel are very stigmatized. And one of it is mental health, which I think it is extremely relevant. I don't know how many of your followers are following the Lindsay Clancy trial. And mental health is something that we experience more frequently as women are in perimenopause and then menopause because of hormonal changes. So I think mental health, just a brief discussion regarding that is warranted. Especially, I don't know how many people are like in other people's chats on YouTube, but I started when Karen Reed Trial 2 was going on. I had never been on YouTube before. I had never been in YouTube chats. And I mean, I used YouTube for videos for my students, like pathophysiology videos and stuff like that. That was how I used YouTube. I didn't even realize that there were shows and chats and all of that. And so I used to listen to podcasts like on my Apple podcast, just audio.
Yeah.
And that's how I kind of got into YouTube. But anyway, so I've only been really active in YouTube for like a year. And through the channel I was watching Karen Reed, then I learned about like these other people. I think, as we all probably have, you learn about other creators and then you go into their chats. And I just feel like recently, the negativity has been so profound that I've almost, I don't know how you feel, but it's almost made me want to step back from a lot of the people I used to watch and I used to follow.
Yeah.
Have you found that as well?
Oh yeah. Like you, I was here for Karen Reed 1.0. But
Okay.
for years before that, I was always trying to, I have to do things around my house and, the whole, single mom thing. So I was always using YouTube for do it yourself. Always.
Right.
And then maybe then all of a sudden I started seeing the things on the Karen Reed trial and then, Melanie Little. And then, this one, that one. But I definitely feel what you're saying is, it's very close to the first agreement that I'm doing with my book club last week, be impeccable with your word. And I feel like, and I don't mean that as be perfect, but it's like, there's so much negativity and it's some of it's funny for a second, but that's it.
Right.
Then you're doing, you're doing to people, you're doing to someone what you hate what they're doing to you. So I honestly, I mean, I'll talk about it one-on-one. If I want to be gossipy with my friends, I'll talk about it one-on-one, but I'm certainly not going to open that up to an audience. I just find it mean.
I do too. And it's unhealthy. It's unhealthy for people to be engaging in that. And it's just, I don't know, in the past, it's not even the past few months, it's been going on for a while. It's really disheartening for me.
Yeah. I feel like you're not alone. And I'm sure there's many people in the chat that agree with you. And it's not to judge anybody. It's not to look down upon people. But I find myself, then sometimes you get sucked in. It's human nature. But I just, after a while, it's like repetitive. It's like, okay, give this certain person, especially one person, give them a break because you don't want her to snap.
Right.
And do something terrible to someone else or herself or himself, whoever it might be. And I'm just being in general. So we have to, I'm really trying to be more mindful, but sometimes, like I said, we all like a little drama, but not the cutting at the knees. And I agree. I understand what you're saying.
And a comment, everyone is privileged to have their own opinion. And that's the beauty, right? Like we don't have to agree on things. And I'm fine with that. Like somebody can say something that I don't agree with, or you make a remark and it's just about a specific situation and then you move on. But I don't know, I guess there's people like doing entire shows bashing people, and it's not mentally healthy for the creator who's spending hours of the constant negativity. And then you get all these people flocking there. I don't know. I've just found it to be disheartening in the population too, because a lot of them these are adults that are seeking out these shows that spend hours of just every bad aspect regarding a person they're discussing, and it's not good for anybody's mental health.
It's really not, because just like in real life, just like when you're a child on the playground, one comment can stay with you and completely change the course of your psyche, and it can really do damage. And I'm not perfect. However, I've noticed it, and I was actually talking to my friend about this the other day about, of course, being, I'm new to this, so of course you don't want to get to a certain level and get certain views and then keep going with this, correct? So
Right.
I'm definitely baby steps. My show's very small and tiny baby steps, but I know how I could get more views. I know how I could do it.
I know.
But my intent on here was there's no place for women to talk about menopause. And of course it grows. And then I'm like, oh, a book club. And then, oh, funny, whatever happens. But you expand what you want to do when you do this. But it's certainly, I know exactly, I was talking about it today. I know exactly what I could do. And I'm not going to do it. Because
absolutely.
I don't want to be part of the cesspool. And anyone that's in those chats, stay in those chats, do what you want to do. But just remember, karma comes back. And just remember the first agreement. And tomorrow night we're doing the second agreement.
Yeah, no, that's right. And you're so genuine. Like, that's what I said the first time. This is only the second time we've like spoken, but even the first time it was, I felt like I was just meeting with an old friend and we were chit-chatting. It was,
that's so nice.
And that's what draws people to you.
Well, thank you.
And if people are focused on numbers and they want to grow, they bring the drama. But that's what I find so disheartening, is that you can get major numbers because you're talking about people in a negative way. And then it's just attracting so many people. Anyway, it's just been bothering me lately.
No, you're not alone. A lot of people have been saying it, and it's, it's sad because it's basically like, I think I told you I work at an elementary school. I'm not a teacher, but I'm on the staff. So I deal with kids, and it's what they're doing is some people are friend collecting, which is collecting views. It's the same thing. And it's, it's not everybody, and it's certainly not to put anybody down, but it does kind of make me go, oh,
Yeah, it starts there. And some of the behavior that I see, I would expect it more in younger people, but most of the chats or the people that I followed, before the content changed, I mean, these are adults. And so I just, I don't know.
If I get out of line, I have plenty of friends to
reel you back in. Yeah, and just like you said, you can certainly have an opinion and speak about something, but I think it's just the ongoing, like, I've really backed off from it because I don't enjoy that, right? I like chats where I can learn and it's fun and you can build a community, and it doesn't have to be a big channel, but when you're genuine like you are, I mean, you're going to grow. It's just inevitable. But yeah, I mean, could you grow faster? Sure. But are you going to feel good about the way in which you grow? If you do it that way, probably not.
Right. I agree
probably
with you.
not.
But you're not alone. Just so you know, you're not alone. And a lot of people are feeling it.
Yeah. Yeah. So I've just really backed off. I mean, I really enjoy following the trials. And I like trials that have a medical aspect to it. So I have been following the Lindsay Clancy case.
Do you want to talk a little bit about like what your feelings are, or do you want to, it's up to you.
Yeah, I will. And it's a very polarizing case. If anybody is following it, I mean, it's horrific. It is so tragic as to what occurred. And, again, I'm in the chats and I see a lot of people making comments. Everybody's entitled to their own opinion. But I do feel that a lot of times there is a lack of information of truly understanding what, if she did have postpartum psychosis, what she may have been experiencing. And so I'll see comments like, I've had depression and I would never, I could never take the lives of my children, right? And that's how most people feel. But if you have psychosis, it is a break in reality. So when you have a rational mind, which I would anticipate the majority of people that are in these chats have a rational mind, mental health illness is extremely rampant. Like when I was in nursing school, I'll give an example and then I'll go back to the Lindsay Clancy case. I was really scared to go to the psych unit, and you have to rotate through. I was really scared. I was like early 20s and I'm thinking I'm going to be around people that are like, babbling and rocking back and forth. And I just, I don't know how to, I was like 21, like I don't know how to act in that type of situation. I've never dealt with it before. And I was assigned a patient who was a nurse. And I had a form that I had to fill out. I had to interview her, and I'm interviewing her. And it was like interviewing the most sane, normal, connected individual. And I'm like, boy, I really lucked out. She was answering all my questions and, sharing about her time as a nurse. And I'm thinking, like, why is she here? And then as calmly and as convincingly as possible, she started telling me about the CIA burying all of these electronic devices in her yard and under her home so that they could monitor what she was saying and what she was doing. And the way in which she was describing it to me at that point, I'm thinking, did this really happen? Because she was so convincing, because to her, it is real. It was absolutely real. And so people don't realize, like, you can have a severe mental illness and present very normal for the majority of the time. But that doesn't mean that they're not suffering from something extremely dangerous, perhaps. And that's kind of what we're seeing with the Lindsay Clancy case. So going back to comments that I've seen, there is a big difference from postpartum depression, which is way more common. The latest stats, if you just break it down to an approximation, about 1 in 7 women experience postpartum depression. So that is, if you got 7 women lined up, one of them is going to experience postpartum depression. It's common. The baby blues are very common, and they usually last about 2 weeks. And so it doesn't get to the extent of what's considered to be postpartum depression. Feeling sad, you get the hormone fluctuations immediately after birth, breastfeeding, all of that changes hormones. So that's even more common. But psychosis is a completely different story. And so when I'm like watching chats, again, people are entitled. There's people who think she is 100% guilty. There's no excuse for what she did. Send her to prison. And that's a valid opinion. But it makes me think that they perhaps may not have an understanding or an education about what true psychosis is, because she has claimed that she had heard command auditory hallucinations. And when that is experienced, it is real. It isn't oh my gosh, I'm hearing a voice in my head and I know it's not real. That's not how it is. It is, this is happening. There is somebody, that voice is 100% true, and they can't differentiate reality from being in a state of psychosis. My dad had he went through Lewy body dementia and Alzheimer's disease. And I remember I had taken him to a neurologist, and one of the questions was, do you hear or see things that aren't really there? And I really have high respect for this neurologist. He's very thorough. And I thought to myself, that is such an odd question to ask somebody who may be experiencing hallucinations, whether auditory or visual, because they don't usually identify those as being not real. To them, it's 100% real. And then when you add in the cognitive decline component, it was just a very odd question, I found, because if you're in psychosis, it is real. So if she had these auditory command hallucinations, it isn't like she was saying to herself, I'm hearing a voice in the back of my head, I know it's not real. It was real. And it was whatever it was telling her, and she acted upon it. And she even goes as far to describe that she really was not in control of the situation. It was more of like an out-of-body experience where she was performing the actions by the direction of this voice that was telling her to go do the steps. And so that is really a huge differentiation between postpartum depression and psychosis. It's that break in reality. And that's what I think a lot of people who are saying, I had postpartum depression and I could never hurt my kids. And I understand that, but you're in an irrational mindset. You may still be experiencing severe symptoms of sadness, excessive crying, irritability, anger, having trouble bonding with the baby. I mean, all of those things are going on, but you're still in reality. And when you have a rational mind, it's really hard to understand somebody who has an irrational mind. right? But so all of
Right.
us who've never experienced would think, I don't see how anybody could ever get to the point of harming a baby and three small
And
children.
I don't think the Lindsay before this happened could either. I don't think
Exactly.
I don't think, if you look back at it, the heartbreaking thing is, her nanny and her friends and, saying how lovely she was and so caring and, just so into, notebooks for her kids. And you can see that if she heard this about someone else doing this, she'd be just as heartbroken,
Right.
and plus she's a nurse. So she's probably, seen this happen to people or close to happening. So you, I look at her in the beginning, honestly, and I was like, I felt the same way when I first heard about it because it's in Massachusetts, it's in my state, so of course, you hear about it quickly. And I just remember going, "What? How could you do that? One, but three." Right. And then you realize, and as I'm learning, and more about it, I was like, "Well, I was judgmental."
And we all are. And it's if you don't know, you don't know. You don't
Right.
have the information. And even if you've been following the case, we really haven't gotten to the point of the experts. We've heard about the treating physicians, but the experts haven't come on.
Right.
And I don't know if the Commonwealth will be presenting the experts, but that is when you're really going to get the information regarding what psychosis truly is. And you can have normal functioning, you can plan, you can go through your daily activities. You don't appear as though you're in psychosis, and it doesn't necessarily mean you don't have psychosis. And I think, there's been a lot of talk about the symptoms. They come and go. They wax and wane is kind of in the mental health community is how they describe it. So it's not like a constant state of severe psychosis where they're constantly hearing things. They may have periods where they hear certain things, and then they have other periods where maybe they're not having those hallucinations. And they can appear as though they're normal. And I think we're getting a lot of that in the testimony, in that Lindsay she was able to make lunches and she took care of the kids and she got up and did this. So how could she be in a state of psychosis? But I don't know. I kind of feel like, as I'm learning as well, I'm not a mental health expert by any means, that some of the symptoms she was experiencing could have been evidence that this was on the horizon, if not already existing.
It was coming down the pike. Yeah.
Yeah. So the big difference is, because I did want to just differentiate some of those, because as everybody is learning about this, when you have postpartum psychosis, that is where they do have the break in reality. They get the delusions. And again, every person does not present the same way with any disease. I don't care what it is. Every individual is an individual. And so they're not going to have every symptom. Everybody is going to have a little bit of a different presentation. But the break in reality is the big indication. And that includes having delusions, the hallucinations. So she had the auditory command hallucinations, at least that is what she's claiming. We're going to hear from the experts. Paranoia, confusion, disorganization, mania, or extreme agitation, decreased need for sleep. And I don't know that Lindsay felt she didn't need the sleep because her main concern was lack of sleep. And lack of sleep affects anybody's mental health, whether you have a diagnosis or not. So when you're consistently having insomnia and not getting good rest, your mental health is going to be impacted. And then poor insight into the illness. So if anybody listened to Dr. Tufts, who I think she was cross-examined today, she did notice that Lindsay had poor insight. So not truly understanding what was going on, which I find that she identified she had poor insight, but relied solely on her in giving the information and not requesting the medical records. That's where I find a big issue, is that she appeared as though she was a good historian and she was able to talk about the meds and give the milligrams, and didn't appear to be stumbling over trying to remember. So she kind of took her for a word. But again, It's like same thing about asking my dad, are you hearing or seeing things that aren't there? You're dealing with somebody having a mental health issue. And so even though they appear very lucid and organized, that doesn't mean that they're giving you all the information. So anyway, I think there were some issues that she was forthcoming with that maybe could have been identified as something more than just having postpartum depression.
Yeah.
So, there is quite a significant difference. And so for people who are like, I had this, not depression mainly, because postpartum psychosis is very rare. Well, I say very rare. It is much rarer than postpartum depression. So postpartum psychosis, there's like one to two out of 1,000 births, a woman will experience postpartum psychosis. And the psychosis is an emergency. That isn't something that we just allow somebody to continue in that state, because they can definitely escalate to the point of self-harm or harming others. Postpartum
Not to
depression.
interrupt you, I just wanted to let you know your dog just moved. So I don't know if you're keeping an eye on your puppy.
Yeah,
I just wanted to make sure.
Thank you. Yeah.
I saw his little tails. I just wanted to make sure you.
Yeah. There's 3 of them.
Okay.
He left. He'll probably come back.
We're looking out. We're looking out for
Thank
him.
you. If you see a big blue sprinkled donut, he's wearing a donut,
Okay.
so he doesn't get to his eye. But
Okay, sorry to interrupt. I just want to make
no,
sure.
I appreciate you telling me. Yeah, no, my stepson's home, so I think he's probably
Okay.
going to check and see what he's up to. If he's eating, maybe he'll get a snack.
Yeah.
So yeah, I just think a lot of times that initial feeling of, oh, she's guilty and she needs to go to prison. I just encourage people, let's wait. Because there's a good likelihood that you don't have all the information. You're not well versed in what psychosis is, as many people aren't. And that is really where it breaks off from not accepting what she did, but understanding that in her mind at that point, if she was in true psychosis, that was a reality for her. And that voice was real. It wasn't like I'm hearing something in my head. It was real.
Do you think now, I mean, I know you can't say this, but do you think now her sitting there, do you notice, I've just noticed this Friday and I noticed it today. She's like looking around now. Before she was just kind of staring straight. And then of course she would have her breakdowns, but I don't know if it's, I don't know. She just seems like she's looking around and more aware.
She is. And, people keep asking, is she on medications? I don't believe that's been divulged at this point. I
hope she is. I would
guarantee that she is on medication. It's in the court documents, I think more for her civil suit, that she continues to remain a harm to herself.
Yeah.
Because now, even if she's stabilized with whatever mental health condition she has, she is aware of what occurred, and she is now living with that grief and aware of that grief for the rest of her life. In addition to the damage that she did to herself, she was a very active individual, and that's been taken from her, yes, by her own doing, but these are things I think she's aware of. So I cannot imagine somebody who's still a harm to themselves. I believe the documents said she is still under 24-hour watch, that she is not medicated. So some people have commented on she doesn't blink much. She kind of has that blank stare. She doesn't emote maybe as much as they would expect, right? That's another aspect of, she doesn't seem as upset as one would imagine, but she has gotten very upset. And I think in the beginning, especially when they were talking about what happened to the children, like the call, the autopsy, the injuries to the kids, she was extremely emotional. And now we're at the point of talking about her own mental health, and she does seem to be a bit more involved and aware. I think this testimony, at least like what's been happening with her treating physicians, isn't as, it's not as emotional for her, because it's involving what she went through, and it doesn't have anything to do right now with the kids. But I do think she's probably on medication. I cannot imagine she's not medicated. And that doesn't mean that she can't participate in her own trial, because that's what somebody else said. Well, if she's on psychiatric meds, then she isn't, she can't be held responsible for what she says. And that's not true. Psychiatric meds don't necessarily make you just completely out of it and unaware of what's happening. But she requires stabilization, because now she had whatever issues. I do believe it's going to come out that she has bipolar that maybe wasn't diagnosed before. And that does require stabilization. So you can't just remove everything just because she's at trial. She still has to have those medications on board, but it doesn't mean she's not aware. But you may see where she doesn't blink quite as much, abnormal lip movements where it almost looks like she may be talking. And those can be side effects of psych medications, which makes me think that I very much feel she's on meds. And I don't know if it'll come out what she's currently on. I don't know if we're privy to that information, but those types of mannerisms that we've seen, to me, indicate that she is on some psych medications just because of those side effects that we see. But I have found her to be emotional when it was very appropriate, mainly around the children, because she is aware of what she did. And I know that's, that alone is a form of, between knowing what she did and being paralyzed and never walking again. I don't care if she ends up in a jail or a mental hospital. She is in a prison internally for the rest of her life. Absolutely. It just is going to be the physical setting of, are you in a psych hospital or are you being treated in a med unit at a prison? That's really going to be the only difference. And being that she still remains a threat to herself, she may never, even if she's found not guilty by reason of insanity, I don't know that she would ever get to a point to be released into the community. She may not. She really is living in her own internal prison.
As to go back to what you said, I think personally, I can, just from what we know about how she feels, I think if she does get released, she's going to take her life.
At this point, I feel she would.
Yeah, I'm not trying to. I think she would take, especially now where I see her crying when the autopsy photos and things like that. She's aware of what she did, and
she is.
She wants to, she's going to hurt that monster that hurt her kids, and happens to be she's that monster. I can't even. Right. It's just so many things we can't imagine, because I've never had a psychotic break. Although, sometimes during the heat and menopause, and you think you're going to it, jokingly. Right. But that's, it's like, what afterwards you say, oh my God, I feel bad. And you stop yourself from, doing whatever it is that you're going to do. So I think that she just, honestly, I think that's what's going to happen. And I think that's what they're worried about.
Right. And when she's in a facility and they are watching her very closely, I don't know that she would ever get to the point of getting past it and being able to be safe for herself. And that is a criteria that has to be met. I don't know that she would harm somebody else if she's stabilized. The chance of having another psychotic episode probably isn't as common. And if it was postpartum psychosis, she is now past that period. But that doesn't mean with bipolar, if her meds got unstabilized, that she could get to the point. And just to share, and I shared this in somebody's chat that was having a mental health discussion. My mother was diagnosed with bipolar, and I don't believe it was very well controlled, and it was a lot on my mother's choosing. And we see it with Lindsay as well. They're not always forthcoming. They kind of make their own decisions. They're listening to the provider, but then they kind of go in their own direction. And it got to the point, and I wasn't expecting it, to be quite honest, but she did take her life. And so when you have a diagnosis like that, if it isn't being, I'm not blaming any of her providers whatsoever, but there's a lot of management that goes in it. It's not just the meds. There has to be a collaborative way of managing any mental health condition. So medication is one piece of it. And then there has to be the therapy, speaking to a professional, being able to talk through what they're feeling. But when people have certain illnesses, they feel, well, I feel better, so I don't need the meds anymore. I don't like the meds, and then they stop them.
Right.
And so we see this all the time. So even if if it comes out that she definitely has a diagnosis of bipolar and she's on medication and stable at the moment, she could always choose to stop the meds. And then the stabilization is going to go away. And that does become a concern,
Yeah. It's really good points. There's just one person made a comment. If you don't mind me, it's a really good question. Dusty Rose, LA, thank you for being here. Tough, the doctor said you had to visualize to see someone in a manic episode to diagnose bipolar. Is that true? Do you know that?
I think during the visits, so in my opinion, and I am not a mental health expert, I do not think she had the classic bipolar where we see episodes of deep depression and episodes of mania. And Tufts kind of described the mania, which it lasts, at least 7 days. And not everybody with bipolar has that. There is another type of bipolar, at least that I'm aware of, it's bipolar 2. And they don't necessarily get to a point of mania. They have more of the depressive component of bipolar, and they may have some hypomania. So it's not going to be as extreme. And in these, it would be like right now, like you all are seeing us for a short period of time. So her visits, I think with Dr. Tufts were maybe 25 minutes. And in that time frame, I don't know that it would necessarily be evident. If it was an extreme state of mania, it was the things that Dr. Tufts described. Like she would be maybe not making sense, talking very fast. But I don't know that Lindsay told her the things that she did. It has come out in court. She ran a 5K, I believe, within 1 week of delivering.
Yes.
And she was very focused on her exercise. She was extremely focused on the baby's schedule. And I've watched a few videos of women I wish they were able to testify, but the judge won't allow it, that had psychosis. And this
he
one woman,
he denied that request.
He denied it. They wanted to bring in other women who had experienced psychosis just for them to talk about what they experienced. And I listened to this woman, and she said she didn't know what was going on because she wasn't educated about postpartum psychosis. And she had no clue what it was. But she said she became so obsessed with the baby's feeding schedule. And we kind of heard that about Lindsay too. And not necessarily saying that it's pointing to mania or hypomania, but it could be. And a lot of new moms, from what people have shared, are very focused on eating schedules, especially when baby is losing weight. They start developing anxiety because baby isn't gaining, they're losing. And that's kind of what was happening with this woman. So she was fixated on it, and she was having some episodes of confusion. She couldn't remember, and she was putting Post-its all over. And then her husband was like, you got to come to bed and get some sleep. But she was wanting to keep writing things down. And so even those types of behavior could indicate, like, at least to the level of hypomania. It doesn't necessarily have to be this erratic, extreme behavior where you're like, wow, that person is manic right now. Sometimes, yes. In people who are bipolar, it is very obvious when somebody's manic. They do excessive shopping. They're excessively cleaning, and they don't need sleep. Their body truly doesn't need it, and they can go days upon days without sleep. And that's not what Lindsay had, because she was complaining about the fact that she wasn't getting sleep, but she was having trouble. So you do have to wonder, even though she maybe didn't get to mania, if she was experiencing some hypomania and it was missed. Because she did, from what I've heard, at least it was around December-ish, that somebody did finally diagnose her with bipolar. So I think at least what I gathered, Tufts was focused mainly on bipolar 1. But there is another type of bipolar, at least another type, where you don't necessarily get the manic. And it is predominantly the depressive. And then the psychosis can happen. It could have happened all on its own. It could have happened due to the medication. And that is one thing. And I think Tufts was asked about this. SSRIs are a very common antidepressant. I'm sure maybe nobody has to say, but I'm sure maybe some people in the chat have taken antidepressants, because mental health in general, that was another thing. Like, I'm like, I don't want to work in mental health. I'm going to be a nurse, not working in mental health. Well, guess what?
Yeah.
Every patient you take care of, the majority of them have some degree of a mental health illness, because anxiety and depression to a degree are extremely common. You don't have to be schizophrenic. You
Right.
don't have to have the diagnosis of bipolar. There
Right.
are a large population of people who have just anxiety and or depression. But giving a patient with bipolar an SSRI alone is not indicated. And she experienced symptoms within the week of that first SSRI. And she did take an SSRI in nursing school before she had babies, and she did okay. But the births can bring about bipolar. It's more common in somebody who has an underlying mental health condition, but not always. So like this woman who was describing her experience with postpartum psychosis, she was of the population that never had a mental health issue previous to delivering her baby. And that's when it started to manifest. But it is more common in people who have a previous mental health condition, especially with bipolar. So she could have been bipolar for years,
Right.
and it just not be diagnosed, because she did, she was, I would consider her to be somebody very type A. She appeared to be a people pleaser. She was a high achiever.
Yep.
And, the other thing, kind of going maybe a little bit off tangent, it kind of bothered me how everyone's like, well, she's a nurse and she should kind of know about meds and, about the process. And yes, she was a labor and delivery nurse. She wasn't with the mom during the extensive period following the birth of a baby. While she may have had some knowledge of postpartum baby blues and depression, I don't know that she was extensively educated in what women experience up to a year after the delivery of a baby. And it doesn't mean she is an expert in psych meds.
Right.
Just like I have some knowledge of psych medication. That isn't my specialty. So, it would be saying like every doctor should know everything about any medical condition, and that's just not the case. So to kind of blame her or say, well, she was a nurse, she should have known better. Those are a lot of the comments I see.
Well, she tried.
No.
You talk about reaching out for help, though. She tried. She wrote it down in her book. I mean, she tried. She told her husband. I mean, it's not like she just, was planning this since she was in nursing school and said, when I have kids, that's it. I'm going to do the worst thing possible.
That's right.
I really feel like she was crying out for help, and when you're that person and you're in the field that you're trying to help yourself, it's like you're the last person to take care of yourself, because you're taking care of your kids, you're taking care of your husband, you're making sure your parents are okay. It's like, this is way off track, but it's like almost like a carpenter or a builder. Their house needs more work than the people that they're building the $1 trillion homes for. But it's almost the same thing. It's like you don't think that because she's a nurse, she should have caught this, but she tried. I really do believe, after seeing what we saw, especially in the notebooks and things, that she did try.
She did try, and
told her friends some things. You're not going to always tell your friends, look, I really feel like, but I think she tried.
She did. And she had a basic understanding. She knew what certain meds were. She knew that, but she doesn't deal with them on a daily basis. And she was in such a depressed, and her big issue in the beginning was the anxiety component of it. And she did want it fixed, and she wanted it fixed now. And a lot of psychiatric meds, not like benzodiazepines, but psych meds in general, like your antidepressants, they don't work overnight. They can take weeks to take effect. And she was so desperate to feel better. She wanted something now. And so I think that is what was prompting. Well, she didn't like the side effects. for one, which is that is valid.
Yeah.
But she also wanted to like instantly feel better.
Yeah.
And I don't know if it wasn't explained to her, or she just wasn't accepting the fact, like, I've been put on this med, it's been a week and I don't feel better. Sometimes you
Yeah.
can actually feel worse. You can have more anxiety when you first
Right.
start like an SSRI. And that's not what she wanted. She was getting desperate to feel better. She didn't want to feel this way.
No.
And, she likely experienced anxiety probably her whole life. I think it manifested a lot in nursing school in a stressful situation. I mean, I can attest to that. And so
Yeah.
she had gone on an antidepressant at that time to try to help to control her. Again, I think it was mainly the anxiety component of it, and it worked fine for her in that. But here she really, because she had the baby and she really wanted that fix immediately.
Yeah.
And that's why she kept going to different doctors and changing the meds. So I don't fault her, but I do fault the system for thinking that because she was a nurse, or people saying because she was a nurse, she should have known better. She wasn't a mental health nurse.
No.
That wasn't her specialty. She may have
No.
had some knowledge of it, but she was also the patient. And I will say from experience, nurses and physicians are the worst patients.
Yeah.
I can share
That makes
what
sense.
I think about what somebody else is going through. And, we don't diagnose or, make treatment plans, but I can have suggestions. And I don't do that as much for myself as I do for others. So to say that, well, I trusted what she said because she was a nurse. You are dealing with a patient who is mentally ill, and
Right.
she's telling you what she wants to tell you.
Exactly.
She didn't necessarily
I
give
think that's a
every
big-
piece.
I think what you just said right there is a big factor in this case, is that, and I think Kevin Reddington is eventually will like bring it across that even, and I do feel bad for Tuft because she was young. I feel like
Yeah.
she was put in a situation where I think she thought she was doing okay, but I mean, obviously there was a lot of mistakes made, but I think if that was a more seasoned person,
I agree.
I think things would have done differently. And you can't sit there and say, oh, she, nobody, I mean, people do not appreciate her, but I'm sure she feels terrible.
Oh, I know
Never
she
mind the
does.
legal ramifications, but I'm sure she's just heartbroken. But you're not supposed to show that on the stand. But I feel like a more seasoned person may have caught it, and I think a lot of things could have been done for her.
I definitely agree. In any healthcare professional, I try to instill this in my students. Like, we're teaching you the basics of the concepts, but there is so much that you can only learn when you do it, and you
Right.
see it and you touch it and you get to experience it. And so she was so new. She had the schooling. I don't doubt that she didn't have the education. She did not have the experience to identify certain things that only comes from treating patients for a long period of time.
Right.
And it's not bad to have a young doctor, or whoever, a young nurse. It doesn't mean that, you're not going to get good care, but they do lack that intuition. And from experience, the things that you pick up that you aren't going to see in a textbook. People are individuals, and nobody is going to completely align. Like, if you take the DSM and you look up certain criteria, just because a patient is bipolar does not mean you can tick off every box there and say, well, nope, can't be that because they don't have exactly what's in this box. Like, that's what you learn with experience. And I do think she lacked that.
Yeah.
She was very new.
I don't think, it's just sad all around. And I don't think, maybe I don't think I've ever heard of a case like this, because she's not the first woman to kill her kids.
No,
I don't think I've
she's not.
ever seen these types of circumstances where, I mean, she was reaching out for help as much as anyone that's, as much as she was going to say. She was,
Right.
I feel, you know what I mean? I don't think there's ever been a situation like this. And it's just heartbreaking for everybody,
Yes.
that for 3 lives, are not here anymore, but there's 100 people that are connected to this family, that are related to these people. And plus the world is just heartbroken.
It is. And that's what some people, and rightly so, they just can't get past that children were are not here anymore. And I totally get that.
Yeah.
But when you really learn that if she truly was in a state of psychosis, it isn't something that she could differentiate, that what she did didn't need to be done. That's the difference. And
that's
so when
when you say that, that's like times 1,000,000%. That's exactly
correct.
what this whole situation is about.
That's
and it
right.
doesn't matter if we take sides of, if I feel this way or you feel that way or someone feels that way. Unfortunately, we're here now, and
Right.
we have to be more aware of mental health issues, and people need to, if you see something, like people say something, because I feel like she was saying it without saying it, because I mean, there's some pride in being a nurse, a mother. You want to make everybody happy. You want to feel like you're doing the right thing. You want to keep working out, and I don't know. I feel like she was saying it.
She was, and I don't think she was totally forthcoming whatsoever. I mean, Dr. Tufts even said she had poor insight, meaning she doesn't understand what's really occurring.
Yeah.
But yet, the other thing that really bothers me is that there was no collaboration amongst the people who were caring for her. They relied solely on her. And I go back to, you have a patient here who is mentally ill, and I don't care how she appears to be such a great historian because she knows the meds, the doses, and all of that. She's still suffering from a mental health condition, and that you maybe don't trust the patient 100% based on only what they say, and collaborate with the other providers.
Yeah.
And it's very vulnerable. How many people want to sit down and describe their worst thoughts and their vulnerabilities, and like they don't feel like they're bonding with their kids, and that they're just experiencing these horrible feelings and thoughts. Like, a lot of people don't feel comfortable to anybody divulging that information, but she did at least say to a couple of people. And a comment that came up during the trial really bothered me, is she was close to having self-harming ideation. I find that a little bit odd that you're close to, because if you're close to it, that means you are starting to experience those thoughts.
Did one of the doctors say that? I missed that.
It's in her record. It was in her record that she was close to it, and not there, but close, which means she's already contemplating. She may not have the plan. Right. She may not be willing to enact the plan, but she was having the thoughts. And that should have been, I think, taken a bit more seriously.
It should have been the cutoff right there.
Right. She's close to. She's not there yet. It's like.
So, but when she gets there, it's already done. So.
Right. So I don't know. I mean, I think the biggest thing is there's a lot of stigma around mental health. Mental health conditions should be spoken about just like physical ailments. We talk about high blood pressure. We talk about menopause. We talk about all this other stuff. Menopause hasn't gotten the eyes on it that it needed, but I think that's improving. Or heart disease, whatever it is. But mental health, there's that stigma, because if you have a mental health condition, people think you're weak, or something else is going on, and that's just not the case, and it's extremely common. So who wants to admit that they're having these feelings and these thoughts? Because you're going to get looked down upon. And she was a nurse, and that is a valid concern. First, I think she probably was concerned that if she was experiencing certain things, that she may have the babies taken from her. But also, you do worry, like, if I get diagnosed with a certain condition, can I still work as a nurse? Exactly. And she may have been aware of that, and just not being comfortable in a 25-minute meeting with somebody she doesn't really know, divulging all of that information. But then certain comments did come out. And I just don't know that if everybody had spoken to one another, that maybe not just relying on what she said, it could have ended differently.
So sad. So it's so sad, and it's real. It's just real. And that's why we put the number up here. If anybody, this happens to be the National Maternal Mental Health Hotline, 1-833-852-6262. But also there's the, I wanted to put if you're feeling suicidal, I just think it's important. Is it 988?
988.
Which is a national, so 988. And don't ever feel ashamed. They're there to listen to you, or call me,
Yeah.
call your
And
friend,
that,
reach out to anybody.
and it's
important.
more common than people think. And
I know.
most
Yeah.
people will mention it at least to somebody.
Yeah.
Not all, but
Right.
most people will verbalize something. And that's when I teach my students, it's not always I'm going to hurt myself. It's not always so explicit.
Right.
It could be a little bit more vague. It could be like, you've got somebody going through, well, let's just take Lindsay, for example. Let's say you've got somebody and they ended up being paralyzed and they feel that there's such a burden. And it may be something a little bit more, not as direct. I feel like my family would be better off if I wasn't here because I'm such a burden on them.
Exactly.
And,
Yeah.
that makes me feel really bad. And I
Mhm.
know it would be so much easier if they didn't have to take care of me. That's a warning sign.
Yeah.
It doesn't have to necessarily be, I feel like I want to hurt myself. And sometimes they will say that. And that's why it's okay to ask, like, do you feel like you want to harm yourself? And some people will say yes. And then we know, but sometimes it's more subtle. And you just you have to pay attention to that and not just discount it like, oh no, you're not a burden and they love you. Like that's a sign that they're having potentially those types of thoughts. Not everybody is going to say something, but a lot of people do.
Right. And it's a different generation now. I mean, my parents' generation, it was like, you don't talk about it.
Right.
You are depressed. Get out there, get a job, do some work around the house, whatever it is, Now there are places, there are people in place, there are numbers to call, there's communities. And now I think we still need more openness and more help for people. But I think it's a much more aware now than it was just say even 30 years ago.
Oh yeah.
It doesn't mean you're crazy and you're going to go, they're going to put you into, what do you call it? The nut house. I forget. I'm sorry to say that term, but that's what I think happened years ago. They would just,
right.
And all they needed was, some help and to get their hormones regulated, if they had a chemical imbalance, therapy. There's so many more resources now, but I still feel like it's lacking.
It is. And that's why, like when I teach, especially I teach about emergency nursing, because that's where a lot of psychiatric crises are going to present is in the ED. And there is still a stigma attached to it.
Yeah.
So, and it really needs to go away. And I really impress upon my students I don't care where you work, you're going to deal with mental health. So don't think you have to work on a psych unit to deal with mental health. Any patient, you have the opportunity of dealing with somebody who's impacted by some mental health condition. Maybe it's not super extreme, but it's still there.
You have to look at the whole body, the whole picture.
That's right. And you got to listen. You have to listen to people, and make people understand that when somebody is feeling that way, because then there's comments that get thrown out, oh, it's such a cowardly thing to do. And I can't, so selfish if somebody takes their own life. And I explain it to my students because I went through all the emotions when my mom did. I was angry. You go through all of that, which is completely natural. But you also have to consider when somebody does attempt or complete, I don't use the word commit. It has a very criminal connotation to it. So I usually say they either attempt or complete. And when somebody is attempting or completes, they are in such a level of darkness that the majority of us, luckily, will never experience. And to them, the best way out of this intense pain that they're in is to no longer be living. And when you think of it that way, it is an extremely sad situation that was their best option in the darkness and the pain that they had. And it's a very, very sad situation, and not necessarily so quick to say, well, they're just cowards, or it was so selfish because the family's left to deal with it. I get it. And it's hard, but
they were in that. They're not thinking they want to put your family in pain. They want you to stop.
They want the pain. They don't want to burden you.
They want to take the burden off of them.
Yep. And they're in such a pain, a mental pain, that they just want to make it stop. And that is their best alternative. And when you think about it that way, it is, it's it's extremely devastating to think that somebody was at that level. So I think we just have to be more compassionate and just not so quick to judge. And so that's kind of, when people have thoughts about the Lindsay Clancy case, again, everyone is privy to their own opinion.
Yeah.
I just think be open-minded, educate yourself. Let's listen to what the experts have to say. A lot of people don't know what psychosis is, so they don't understand it. And they're like, well, I would never do that. No matter what I was going through, I would never do that to my children. You've probably never experienced psychosis.
Yeah, or never seen anyone go through it.
Correct. Or understand what it really is.
Because it can be, it can be quick, right? And then it can be, it can last longer. I guess there's no, I guess it's not prejudice to time, right? There's no.
No, it's not. And that's the thing. That's another misconception, is that they think if you're in psychosis, you're there. And so you're always in this state, and it's not true. And a lot of medical health professionals use that terminology of waxing and waning. They come and go.
Yeah.
And so you literally can be appearing as though you're functioning and normal, and then very quickly have a hallucination or a delusion. And I think that is potentially what Lindsay experienced. And so they're like, yeah, that day she took the daughter to the doctor and she communicated fine, and she was able to call the restaurant, and she was coherent. She wasn't babbling. That to me is the misconception of understanding psychosis.
Okay.
Because you do appear that way. You don't always appear as though you're in this super manic state of, just being, totally uncontrollable. It just, that's not the reality of it.
Well, that's that's some good information that we've given to me, to anyone that sees this on the replay, whatever it is. That's, we have to be impeccable with our word, and we have to be open to hearing what the experts have to say.
Yes, and that's who I'm really interested.
Unless you've seen it yourself, someone that maybe like me, who's never seen it or experienced it myself, I don't understand it.
Right.
But I know I want to.
Right. And that's what I think I've said this a little bit, is that it's very hard for a rational mind to understand what somebody with an irrational mind experienced. And so it's very quick to judge or have an opinion of, I don't care what was going on in my life, that would never happen. That just says to me, I get it. Most of us would hope we would never, ever do something to the extent of what occurred with Lindsay. But that is lacking the understanding and the education. And lay people aren't expected. Like you said, you've never experienced it, haven't known somebody, you're not in the medical field. You don't have the knowledge. It's not your fault. But we can't be so quick to judge. Let's wait. Let's hear what the experts have to say. Let's hear what she actually has been diagnosed with. I'm pretty sure they've said she got the bipolar diagnosis, but I haven't gotten a lot of information, so I'm waiting for that.
I did hear that a few times, but I don't know if it was a complete.
Yes. I don't know if it was more of an alluding, or if she got the official diagnosis. I believe she has in her civil paperwork, but I would like to hear the experts. And I just encourage people to, to wait. Let's gather all the information, the expert testimony. We've not heard expert testimony. These were treating physicians. So there is a difference between the treating physician witnesses than the experts who are going to come on.
Okay.
And so we have not seen any experts test. All of the psychiatrists who have testified so far have treated her in some capacity. So we're not at the expert level yet.
I'm glad you're saying that, because I was confused by that. Now you just cleared that up, because I was like, well, wait a minute.
Yep. And they can appear as experts because they have so much experience and all of that, but they're not testifying as an expert. They're testifying as one of her treating physicians.
Okay. So these are probably going to be people who, doctors who haven't treated her.
Correct.
Okay. All right. That's going to be important to see too.
Yep. And I assume the Commonwealth is going to put some experts on. I guarantee you the defense is going to put some experts on. I know there are a few that are on the list. Some of them are going to be like psychiatrists. I know some are going to be more about the physical injuries, because there's the whole presentation that maybe she didn't have a true attempt. Again, if you're in a state where you have a break in reality, you're not necessarily going to say, I don't know if this window's high enough, right? Like she's desperate and she did three
Right.
different things. She downed pills, she self-harmed, and she somehow, however you want to say it, left the window and she's paralyzed. So you cannot tell me that wasn't a major injury. But in a mind that had a break in reality isn't necessarily saying, well, is this enough pills? Is that a high enough jump?
Right. Yeah.
To me, it showed the desperation that she did three different things to try to do it.
Yeah.
And so
Yeah.
that was, just like in a panic, just what could possibly, maybe some of this. And then now I don't know if it's going to do it. And then, just kind of leaving the window as the last ditch effort.
Yeah, because they were saying she's a nurse. She should have cut this way, like vertical instead of horizontal. But that's what I'm saying. So I'm glad you're saying that, because you're right. You're not thinking, well, I'm a nurse, so this is, because she's not a nurse at this moment. She's not her. She's not her at all. She's just someone that wants to listen to the voice, and she's in that psychotic break. So she's not thinking.
Correct. And I mean, she at that point knew like wrists and neck or the typical locations, but and it's a lot harder to self-harm yourself. I mean, you can only imagine the discomfort, but exactly what you just said, she wasn't in reality of saying, well, I'm going to have to go to the depth of an artery at least. It's quick, and things had to have happened very quickly. And so she was just going through whatever she could think of to try to accomplish it. So, I don't know. It's a sad situation, and I know it's a polarizing case. I just encourage people, for what it's worth, get all the information, get the education regarding what psychosis is. Was she in a state of psychosis? And try to fully understand as much as one can, who's never experienced a break in reality, what somebody may experience when they are no longer in reality. It was 100% real for her.
Right. Do you think she'll take the stand?
No.
Okay. That would never happen.
I do not. Okay. I do not. I don't think Kevin Reddington would ever let her take the stand. I really don't. Okay. And I don't think she needs to, but I wasn't sure if. My opinion, I don't think she would. I think the expert testimony and her injuries alone, I think that will be able to provide enough information. I don't know what she remembers. I don't know that that's really come out. I know they've kind of gone against what she asked when she woke up, those types of things. But, if you've done something absolutely horrific, I know that you're going to be one to want to talk about it.
Yeah. Yeah. Have you ever read The Bell Job by Sylvia Plath? I feel like that book can bring so much insight into this case. It deals with both depression and psychosis. All right. That be just wanted to ask.
Yeah.
I guess any resource, right? I think you're going to see a lot of books like this now. People are going to be ordering books, library, YouTube videos, because people are so intrigued with this case, because it could be anybody, whether you want to believe it or not. It can be anybody.
That's right. And so like postpartum psychosis is more common in people who have a previous mental health diagnosis, but that it's not, again, healthcare and medicine is not black and white. There are women who have had postpartum psychosis without any previous mental health condition. There's if you want to read, I think that's great. There are some reputable resources that are kind of going much more in depth about the differences between depression and what psychosis is. If anybody follows, I Don't Belong Here with Sam Badigno, she is a mental health expert with over 25 years of experience. She's done some excellent videos because she has the expertise, and I'm not saying she blames Lindsay, but she identifies things that Lindsay did that made her an untrustworthy patient, not by her fault, but because she had a mental illness.
So it's I Don't Belong Here. Is that a YouTube channel or is it a?
It is.
Oh,
It's a
okay.
YouTube channel. Yep. I Don't Belong Here. And
Okay.
I think that's I Don't Belong Here podcast. It might be the full name, but I really like her, and she's
Okay.
done several videos on Lindsay Clancy.
What was her name
and
again?
Sam Benigno. I think it's Benigno.
Okay, I'll find it. But anyone else, I can put that in the chat later. But thank you for that resource because it's interesting. It's like you want to hear more about it. You want to. I think people are looking for answers, but I don't think think we need it. I don't think during this case, just from what I've been feeling, I don't think we're going to get an answer. I think we just want to. I think people want justice for the kids, but there are some compassionate people who want some justice for Lindsay, and Patrick and his family. But I'm saying that I feel like this is just so complicated. And it's just like, it's almost like it's so easy to say, all right, well, she did that. Well, she deserves it. But it's an onion. You have to peel back those layers because this is a woman that loved her kids, wanted to be a mom. Did.
And everybody attests to what a great mom she was.
To me, honestly, I know medically, when the experts come out, that's going to be telling. But to me, when the notebooks and her family and the nanny and her friends, because you might have a group of 5 friends, but usually there's that one person you're going to say a little more to than like another person for whatever reason or whatever moment you're sharing with them. But that to me was the true testament. It was like I didn't hear one thing that she was.
Right.
Even the child, even when she would go to the Kingstown, whatever the fitness facility was, even the girl that was there was like, she was never mean to her kids or nothing. And, sometimes people, even in the parking lot, at the grocery store, you can kind of lose it,
Right.
But it seems like this wasn't the case.
Right.
So just like Dr. Trae says, just give it a chance before we all judge, I guess. Right.
You're definitely going to get conflicting expert opinion as we do with every case, right?
Yeah.
But and then after you've been educated from both sides, because there are going to be certain facts that you can't really dispute, then formulate a decision. I have seen a few people in some of the chats where I'm try to watch the trial say, initially I thought she should go straight to prison because this is such a horrific act, which I don't think there's anybody who says what she did isn't absolutely horrible. But they have said, as I'm learning more, now I don't feel that she did it from just being malicious. I'm starting to understand that she was really mentally unwell.
Right.
And that it is likely, because what other motive is there for what she did other than just having a complete disconnect of knowing what was going on in that moment. And like I mentioned, when they hear certain things or see, if they have a visual hallucination, it is real. It is there. And this woman who described her story, I so wish a couple people could have gotten on the stand. I understand why they couldn't, but she said she was seeing people walking by. She would get like shadows that were walking past her. And it wasn't like, I know that's not really there. She just accepted the fact that there were other people in her home. Like that was how she was accepting it. And I couldn't imagine, because again, it's hard to imagine an irrational mind to just be like, there's somebody here with me and feel like you can accept it. But that it was happening so often. She's like, I guess this is just how it is now. And
so I'm curious. So being in the field that you're in, and you're a teacher and you have your doctorate, and you're in this, I know you're not a mental health. I mean you're not a psychiatrist, but you're in the field. So do you find the majority of the people that bring up this case to you that are in your field, what are they? Do they feel the same way you feel, or is it a mixed bag?
I think it's still a mixed bag. I think people who do have some education regarding what psychosis actually is, and if that is proven as to what she was likely experiencing, they realize that that is highly likely what occurred. and it can come on quickly. People
Yeah.
think, because again, I think I already mentioned this and I want to keep repeating myself, but some people think if you're in psychosis, you're there and you stay there. And that's not how it is.
Yeah.
And over, sitting here and having a conversation, that person can appear very normal. And I don't even want to use the word normal, but lacking having an issue. And that doesn't mean that they're not in a state of psychosis.
Yeah.
And if you don't understand that, then I understand where certain opinions come from. But that's why I just keep encouraging, get educated. Nobody expects everybody to understand what that is, but you've got to have an open mind that it is a high possibility that that is what occurred. And there's no winners. Nobody's going to be, it doesn't matter which decision comes out, the kids aren't coming back. No. And whether she lives in a psych institute or she's in a jail, she still has to deal with her own internal condition for the rest of her life. And nobody is going to bring the kids back. But people feel the only justice for the kids would be if she goes to prison. And I get that, but you have to take into account that she could have been very, very, very mentally sick.
So with that, let's all do what Dr. Trae said. She gave us some good advice. Let's just try to keep an open mind.
Yeah.
You can have your opinion, and you can, your opinion is not wrong, but
right.
Let's try not to be judgmental right now. Let's just, and
just have respectful conversations. And I don't doubt that everybody in your chat doesn't. I think you have a wonderful chat, and I'm sure people do communicate in a very respectful way. You can disagree.
Yeah.
Nobody's going to ever agree with everything. But that was, going on how we kind of started, where people are just online. It's like the way that they talk to each other. These adults are treating people, and they're so quick to say something. And it's the same thing when I can't even watch the chat in any of the channels where I'm watching the trial, because the comments, they are, atrocious to me. The way that they're expressing an opinion, but they're saying it in a way that is just, it's just not called for. You can have an opinion without just being heartless and purposefully cruel.
Exactly. So that's why I guess we just, you stay away from the channels that are going to bring that, or if you like that and enjoy it, and it makes you feel better, then I guess where to go. But
right,
I won't get that here in this channel, but there's plenty of channels to do that.
Oh yeah, and some of the places I'm watching, usually the chats are fine. It's just the cases, it's just a very polarizing case, so I just don't enjoy. And misinformation being spread. We were going to talk about another topic, which we can certainly do another night, which also has a lot of stigma attached to it, which is the use of GLP-1 medications that I wanted to talk about. But it's just the way in which people present an opinion doesn't have to be as an attack to somebody who has a differing opinion.
Yeah. I totally get it.
In a respectful way.
Yeah. So I know you had a couple rough days with your beautiful fur baby. Yeah. So maybe if you want to come on another time, and maybe we could do the GLP-1 menopause one, if you feel like you want to do that. That way I feel like I don't want to keep you. We can stay here we can stay here as long as you want, but I just, I'm thinking about your little guy, and I know you probably.
No, I appreciate it.
You probably need to, catch up on some just like, you time and doggy time. So if we can end it whenever you want, and we can. It's up to you.
I'll definitely come back and talk about that. I just felt because everybody's kind of in the midst of
I'm
the
glad.
Clancy case.
Yeah, well, I remember we talked about it before, and I was even hesitant if I was going to watch it myself. And then I found myself, I was like, wait a minute, this is just not cut and dry. And then when we discussed it. So I know my chat loves you. My chat appreciates you. I appreciate you.
Very sweet. Very sweet. I appreciate that.
Yeah. So I hope your baby gets better.
Thank you. I do too. It was, things tend, you must be downstairs. Things tend to happen on the weekend when you can't get,
of course,
when you can't get seen. So it was a very, very long weekend.
It's always a weekend.
always. And I'm like, I would drive him wherever, but on a weekend, good luck.
See his little tail back there.
This is one of my doodles.
Oh, so this is oh yeah, okay. So it's
I
not
have
the one
two.
that.
I have two golden doodles and a golden retriever, and it's my retriever that
Okay,
has
that's
this going on. Yeah, and it's just it's just horrible. Any of you who have any fur babies at all, when something's wrong with them, it's just, at least for me, it just,
yeah.
it's the worst.
They,
And
they're
this is
family, they're
painful.
family, and you love them, and you want them, just because you want, you can tell there's something wrong, and you want.
Oh yeah.
They can't talk to you, but you know your babies. They're your babies. So
Yes.
with that, I don't want to keep you any longer. I appreciate you being here so much.
Thank you so much for having me. And hopefully it was, I don't know, I feel like it was just more of a
I think
talk about the Clancy case, but just
but it was
mental health in general.
But
I
it was,
just think it's
I
important.
appreciate your insight. Like I said, I know you say you're not a doctor, but if you wrote me his prescription, I would listen to you. So everybody in this chat has so much respect for you. So
thank you. I appreciate
you
it
so much.
I love chatting with you, and I'll definitely come back and we'll talk about, I definitely want to talk about that. I think it's important, especially as we are, in perimenopause and menopause.
So
for people to understand the benefits. Yeah, we'll definitely do it.
You know, you have my information. You reach out anytime, and it doesn't even have to be a Monday night. If you feel like going on some other time and you want to just kind of focus on that, that would be great. But I appreciate you.
Okay. Well, thank you so much. Thanks everybody. Have a great night.
Thank you.
Bye-bye.
Take care. She's the best, isn't she? Wow. Now let me get down to it. Expert. I saw your chat. I saw your message. But it wasn't the appropriate time because we're talking about some serious stuff. How's everybody doing? I wasn't really keeping up with the chat because it was such an important message. And Dr. Trae is she's so well spoken, and she's just so beautiful, and she's just so kind, and I appreciate her being here. That's a tough topic, but there is help, people, and there is hope. So I'm just going to go through the chat really quick, if you guys don't mind. I feel like I might have missed. I didn't want to have her ask too many questions. She is dealing with a little bit of health issue with her puppy. Schmopey, happiness. Hi. I'm just going to go through. Nanny Go. Hello, Nanny Go. I hope you guys thought that was eye-opening, because it was eye-opening for me. And she's right. I'm going to wait until I see the experts. Experts. I can say that as. Hey, Kristen. I know you guys probably, everybody probably knows someone that's, gone through some kind of depression and tough times. So, hi, this is my BFF iced latte. Thank you guys for being here, Kristen. How are you? Dizzy, hi. Wow, there's a lot of people that I didn't get to see. Hi, Julie. I know you're going to head and go on to your show. Julie, if you're still here, what time are you going on, or did you already go? Are you already on? So I was trying to figure out how to do a raid to have everybody go to Julie's chat, Bayhaber Beauty. Hi, Genuine. Thanks for being here. Cybercheck, hi. Some of you may have come and gone, but I appreciate you just coming in and saying hello. Could you do that in Machad's chat, Dr. Trae? She's so lovely, isn't she? Glad she came on. And then, like I said, next time we're going to do the GLP-1 with menopause. This subject, I think, just probably needed to be by itself, So happiness, mental health is real. Nanny Goat, my daughter had 2 babies. This has made me check in on her constantly. I'm so worried. Oh, that's nice, Nanny Goat. You have to. Schmoopy, mine got bad when my twins were born, and I already had 2 at home. I just broke down in tears, so they had to stop people from visiting. Schmoop, I got you, baby. We're here, baby. Michelle, hi, Michelle. I heard someone predict that they'd find a BP bipolar diagnosis combined with everything. It makes Hi, Dusty Rose. Thank you for being here. I think this is your first time here, so I appreciate you being here. You guys are great. Good topic. Oh, Kimma Rosalie, the system failed her. Hi, how are you? Thank you for being here, everybody. some new people that are exciting to see some new people, and my my good friends are here supporting me and my channel. I appreciate it. Magic, hi. Her husband, family, and in-laws let her down. Yeah, it's just such a complex case. It's like I said, I don't think we'll ever see anything like this. I hope we don't. But this was just something different, you know? Yeah. So there's a lot of comments here. I appreciate everyone in their comments. I probably will look through them. I didn't want to do it, like I said, while Dr. Trae was here, because I knew she had some things to say. But you know, she's so gracious. When I heard today that Lindsay's mom slept with her downstairs, I bawled. She just wanted her mom and not being like, oh, that's right. I think I kind of went in and out today because I had different things I was doing. So I might have missed that, but I think someone mentioned, yeah. See, because that's what a good mom does. And her poor mom sits right behind her every day. She just must be, Hi, Heather. How are you? I think I'm trying to see what time Julie is going on. Is Julie on yet? Can you find out for me? Because I want to, I know she wanted to go on and she was waiting for me. Oh, Heather, woof. We're here for you, Heather. Always email me at Miss Habib-able if you need to talk. I'm always checking my email. You have a lot of support here. You guys are great. Nanny go, Heather, love you. I know. Oh, happiness. Wow. So you saw that. It's so hard, isn't it? It's like, everybody's so nice in the comments here. There's so much support here. I have the best people. Thank you guys for being here and being who you are. I'm not going to be on my best behavior expert. I don't want to end up on Jimmy's reels again. Okay, so yes, I appreciate you guys being here. I appreciate Dr. Trae. Hi, Nikki. How are you? So she's going on at 8:15 my time. Okay, thank you, the expert. So you guys, anybody want to chat about anything else? How can we make this a little bit more lighthearted? It's a tough topic, but it's an important topic. So 8:15, if you guys want to head over to Bay Harbor Beauty. I think me and that B are trying to figure out how to do a raid, which would send everybody to her. So try to figure that out. I'm in the Northeast here in Massachusetts. It is so humid. I have my ice roller. How's everybody else doing? Expert, you still here? How's the weather in Tennessee? My nephew lives in Nashville. He's trying to get into the music industry. Yeah, it is so hot. It's 91 degrees. Yeah. Humid. The humidity kills me. It makes me angry. I'm like I said in the beginning of my stream, if I'm hungry and hungry and humid does not mix well with Habib. The 3 H's. Yeah, I think it must have been in the 90s here too. And I usually go to the beach for a couple hours. I just didn't get there today. So, does anyone know, did Valhalla get his hype thing? Because I did all my hypes with him. Gave him, I didn't even know you could hype. I didn't even understand what hype was. So I'm hoping he's close to that now. Maybe somebody in the chat knows. Oh, thank you, Heather. Humor hell. Humor heat in hell. Where's Kristen? Are you still here or did you leave? Kristen, did you leave? Oh, you gave him your hypes too. Is it Kimmer Rose? How do I say your name? I want to make sure I say your name right. Kimmer Kimmer Rosalie. Kimmer Rosalie? Kimmer Rosalie. Did I say that right? Hope so. That's nice. Expert off topic, but I meant to ask you, are you a Marvel fan? I always see the Captain America shield in the background of your stream. Oh, wow. Good eye there. Good eye there, that be. I think the hypes are only good for the first 7 days. Oh, really? Oh, because I thought it was that one particular show we were hyping, but my 3 hypes worked for him, so I learned what a hype was. Julie, I'm still trying to figure out how to do a raid. You're going on, expert said 8:15, right? Okay, well, we have some people that are here in the chat that have shows, so I'm sure everyone's already, if you're not, please like and subscribe to The Expert. He's got a great show. Bay Harbor Beauty. Please like and subscribe to her show. Let's see who else. I think I saw Cyber Chick here. So Cyber Chick Boston. And who else did someone else have Valhalla, Valhalla. If anybody has a hype, go hype them. And I don't know if anyone else does either, but so that's that. So feeling hot. Yes, Schmoopy, you're down by you got the breeze though. We getting a nice breeze tonight. Nikki, oh, you just took a swim, huh? How was that? Did you go in the pool? I don't have a pool. We all learned that. There's the experts chat. Valhalla awaits. Oh, Valhalla awaits. Thank you, Julie. I know I'm terrible when I'm saying the names because I just type it in and it comes up, but not everybody knows. So, yes. Bay Harbor Beauty, his Bay Harbor Beauty's chat. Anyone wants to get some great skincare, go to bayharborbeauty.com. I think there's a code. I think there's a Miss H 10% off code. I can't remember. Terrible rememberer. But anyway, either way, Bay Harbor Beauty has some great product. And you have any questions, she is great on answering questions. Cyber Chick Boston, there's your link. Valhalla awaits. Thank you, that B, for doing this. Did we figure out how to do a raid? Because I'll hang out here until I think Julie would have to go live first, right? And then I would still trying to figure out how to do the raid. That B, do you know how to do it? Because Cyber Chick raided me one time, and that means a raid is everybody that's in my chat would go to say Bay Harbor Beauty's chat, and then that's how you get, that's how you get your little algorithm going, and you go in there and you make sure you like and subscribe. It helps. Don't ask me how or why this works with YouTube, but yeah. So yeah, but if I do mess up this raid, people, go over to Julie's channel, which is Bay Harbor Beauty. At 8:15, she's going on. It helps. Yeah, 15, 20 minutes. So I might just sit out here and chit chat. Wow, I'm looking out the window. The sky's really pink. I bet we had a beautiful sunset tonight. Do you know the sunset is now before 8 p.m.? I know, I'm sorry to say it. I do my sunset walks almost every night. And I'm like, oh no. I remember when it was 9 o'clock and it was just getting dark. How did this happen? How did it happen? I won't be there for another 15. That's okay. Even if I'm end up getting off before that, I want you all to go to Bay Harbor Beauty. Just go in there, watch her show. She's wonderful. She's great. I think I saw something up here. Let's see. Oh boy, Dr. Trae is wonderful. There you go. Please hold. What? What say you? I'll just give myself a little shave. La la la. Wait a minute. I thought I saw something. Hey, hang on. Ooh, let's see. I'm looking. Hang on. I'm looking. Da-da-da-da. Sorry, guys. It's all just watch me stare at the screen. Sorry, I'm just looking for. Now we go to channels where people. With, well, especially don't send me to a channel like that. Uh, he's such a good guy, and his wife's great, and we all know how kooky I got. Look at me, I'm all composed. A couple intensive therapy sessions. Hey, oh, wait a minute. Don't worry. I'm okay. Did I put deodorant on? Oh, dang it. Should have put you. Thank you, expert. I appreciate it. Okay, let me just move right along. Do. I'm just doodle. Kristen, did you leave me? Kristen, where did you go? Do you have a life outside of Miss Habib-able? I explained it all above Miss H. Okay, Julie, we'll see you in a little bit. I'll be there. I'll be there. Is anyone else here? Did everybody hit the highway? Oh, that's good. Thank you, Schmoop, to go in there and say hi and click and like. It's a whole different world, this YouTube world. It's very different than real life. But you got to maintain, you got to be normal. You got to be normal, stay grounded, and once you understand that it's about the likes and the clicks and the comments, if you're trying to grow your channel, just, stay true to yourself. That's what I would say. I could potentially be talking to myself. Everyone could have left, and that's okay. But I haven't seen in a while is Rhonda. Hope Rhonda's okay. Has anyone heard from Rhonda? Is there anybody out there? Ooh, I've become comfortably numb. Schmoopy, thank you for coming on and talking about mental health. It's a topic that if more people talked about, maybe more solutions could be figured out where the meds fail. Yeah, I know. Oof. But yeah, so this was a good topic. Thank you all for being here. I ate inside one at the restaurant, his booth. What restaurant was that? Did we figure out how to do a raid? Okay. Kristen, come back and see me. Help me, Rhonda. Yeah. Heather, they always say be yourself because everyone else is already taken. You know what, Heather? I think you should call up the Yogi Tea Company or Salada. Mine's the Yogi Tea because I like the blueberry tea and I make iced tea with it. Like the old-fashioned way. And I put it in the mason jar outside and I let it sit in the sun all day. But it's blueberry tea. And they have sayings on this. I think that you should make that up. I think you should market that. Be yourself because everyone is already taken. How do you like me now? It's very good. I like that. So is it just Schmoop and Heather? We're the only two in the chat, which is fine. It's okay. Michelle, did you leave, honey? I'm here just slow today. Yeah, it's the heat. It's the heat. That was a good one, honey. I think that you should market it. Okay. And I think you should just put it on all the tea bags in the world. I'll buy it. I'll buy one. I'd buy some tea bags from you. It's someone else's quote. Well, you know what? Just change 2 words. We'll make it yours. Isn't that what they do anyway? Well, you know what? You could put they always say because you're giving props to whoever they are, right? All right. You came from Jimmy. I've been listening, just not chatting. Hi, Kayla. Thank you. Yeah, I heard Jimmy a little while ago too, but then I had to go and get ready for my show. I'm going to watch the rest of it. He's so funny, isn't he, Kayla? Thank you for coming over. I appreciate it. It's nice to see you. You're always welcome here. I'm just trying to bide some time. I'm going to try to figure out if I can do a raid to send everybody over to Julie's channel because I don't know. I just think it would be cool. Hi, Kayla, says Heather. Hi, Kayla. Welcome. See you. Very welcome here. Thank you. I don't know if you missed. Oh, so you did hear about the Dr. Trae being here and stuff. Yeah. So the next time she comes on, whenever it's good for her, we're going to go over. We're going to try to mix in the GLP-1 with menopause during menopause, but we got, on such this postpartum psychosis and the Lindsay Clancy trial, it was kind of like smart to just stick to that. So if you want to ever join that, I usually try to put a link up, a thumbnail up. I'm getting better at thumbnails. My thumbnail, see? Thumbnail, get it. Oh, you found me through Jolene? Oh, she's so funny. Thank you for being here. I appreciate that. Am I saying your name right? Kimmer Rosalie? Kimmer Rosalie. Kim Rosalie. Can I just call you Kimmy? KRL? I don't want to say it right. Can someone post this Jimmy link? Oh, you mean Auntie Deb? Is that what you mean, Schmoop? Or are you talking about yeah, if you just go on Auntie Deb 3Bs on YouTube, you'll see him. He's just a hoot. Heather, I've got to go over to Julie's stream so I can mod. Okay, great, awesome, great show tonight, Miss Habiba. Great mods. Love this nice group and ladies you've collected your chat. Thank you, and I appreciate you being one of those ladies in my chat. Good, I'll see you over at Julie's. I am trying to hang out to try to raid her. I'll probably do it wrong, but I'm going to try. So thank you, Heather. Take care. Hello, everyone. Yes, Jimmy is hilarious, says Kayla. I've been with his channel since his first live stream. Me too, but I never talked for a long time. I've been since his first live stream. Yes, I love that you guys are covering all that. It's so important. It is important. It's important, and and it's important the way Dr. Trae kind of thinks the same I do. You have to kind of keep it. You have to keep it like real. Yes, I have heard all the things about people are accusing Patrick, and I have my own strong feelings on that, certain things and this and that. But sometimes it's nice to be able to just kind of focus on the issue at hand is, postpartum psychosis. It is real. So I appreciate you being here, Kayla. Thank you. Yeah, Schmoopy. Heather, it's a pleasure, says Schmoopy. Heather's such a nice person. I mean, there's so many nice people in this chat. Yeah, so Schmoopy, Auntie Deb, you got to go it's so funny. And I don't know if you saw it. You probably did, Kayla, when he... Did you see the video where he did commentary on me in my goofiness because I don't know how to handle myself? It was funny. He just made it so much funny. Schmoopy, generally, people with larger channels raid the smaller channels to help them get subs. Yeah, no, I know that, but I figured there might be a few people on here that would do that to her. Cyber Chick did that to me last week. So I'm gonna try. I'm just gonna try to do it just to be able to learn how to do it. Kayla, absolutely, especially with all the craziness right now. There were stakes made all around on this case. So bringing awareness to it is amazing. It is, and thank you for saying that because it is. It's just, it's I'm from Massachusetts. A lot of my friends here in the chat are, and it's it's like within probably an hour and a half ride if I'm going 90. But it's not too far away when you hear something like that in your home state. It seems like there's so many things that are happening in Massachusetts. And I'm like, good Lord. It's like, whew. Oh, so you did see it. I think I've composed myself. Like I said, extensive therapy for the last 3 days. And when the expert comes around, I can handle myself because I want to be respectful. I respect him and his wife. Although one person made a mean comment and Jimmy straightened her out. The meds caused that psychosis, if you ask me. Well, yes, don't think that she would have done that. You had to go off screen. I would have to do the same if someone that came on my show I was doing. I just went off for a minute and I was like, whoo, whoo. Kim, oh God, Kim or Rosalie. I don't know why I'm having such a problem. Smoopy, I think so too. How about Kim? Look at what Smoopy did. Right, Kim, I've seen it before. That B, are you still here? I'm just trying, I want to make sure I can do this right. I know it's a bigger channel, Smoopy, that it usually happens from, but I may be big someday and I need to prepare myself. Oh, you don't know. I don't know either. Oh, well, everybody go over to Julie at Bay Harbor Booby, Miss Habib-able. Go over to Julie at Bay Harbor Beauty. She'll be going on around 8:15, 8:20. She's great. She's been so supportive to me and my channel, and I just have a great connection with her. So, I just think the world of Cyber Chick as well. We have some pretty awful cases here in Ohio, so I think it's everywhere, unfortunately. It is. It's not geographically, it's not prejudiced to anything. It'll just everywhere. It's widespread, like a lot of things. So you're a Midwest girl, huh? Ohio. That's where Travis Kelsey's from, you know. If you're not a big fan, I'm sorry, but I need 1,000 to do a raid. Okay. All right. Well, that's probably, I'm going to be positive, but that's a long way away. That's okay. Baby steps. So I think, I'm not sure, either tomorrow night or Thursday night. I have to decide. I'm doing the 4 agreements with my book buddy, Paula. And she can't make it tomorrow night. However, she can make it Thursday night. So I thought maybe tomorrow night at 7, I would go on and do the 2nd agreement just by myself and then do the 3rd agreement on Thursday with her. Because, I want to get this, I want to keep rolling with it. So I'll let you guys know if you're interested in doing that. I like doing book clubs, but I didn't want to do another menopause book club. We did one, I say it, Paula and it was in the beginning when I first started, and it was with Naomi Watts wrote it, and it was just amazing, the access. So if anybody's going through perimenopause or you're getting near that, read her book because she has access to all the best doctors in the world. And it was a really interesting, it was funny too. It wasn't like a medical book. It was more like a life experience, and I loved it. Smoopy, I'm going to say it again. The first thing to do is check vitamin levels when someone isn't right, not throw poison down their throat. So when you say vitamin levels, is that like a hormone panel, blood work, or is that something specific? You know what I'm saying? Someday you'll be able to do a raid. Thanks, Michelle. And I hope that you're here with me to do it. I hope you're all here with me. Kayla, born and raised. No, I'm not big onto Travis, but that's okay. Ironically, I was a huge Tom Brady fan in my whole life. Isn't that funny? And then he came here. God, he's just amazing. He was like, we were lucky being in Massachusetts. We got to go. I went to a gazillion games, and it's phenomenal. That's okay if you don't care for Travis. To be honest with you, Kayla, nobody knows this, but I told him to go marry Taylor, and that I wasn't good enough. No, excuse me. He wasn't good enough for me. Take a hike, Travie. See, told you I'm kind of like, I'm kind of mental. Smoopy, you know your stuff so true about vitamins. Yeah, Smoopy. Let me tell you, Kim, she is very knowledgeable. She's my IRL friend in real life, and she's helped me a lot with things. Very educated. One day she'll come on here. One day, I know. Like, whenever you're ready, I'm not pressuring you. I get it. Schmoopy, we need to get you on Miss H's show. Oh yeah, isn't that funny? I just said that. Depression could be a thyroid issue or low vitamin D or magnesium. You know what's funny? Not funny, but you know what's interesting? Schmoopness. Reddington was talking about her thyroid, and did they check her thyroid? There's a whole thing about that. So, right. That B, they'll either love me or hate me. No one's going to hate you. She is smart. It's an honor and a privilege for me to be able to take a 4-minute ride and go see her. Kayla, exactly. You deserve much better. Haha. When I was a little girl, my dad was yelling at the TV. He was a Raiders fan, yelling at Rich Gannon, and because they were playing against New England, I rooted for them. Isn't it funny how some people, you can be from a whole other part of the state, and then you like a different team? I know. There's some, let's say there was somebody was like, how are you what was the team? It wasn't the Patriots. I think it was a Raiders fan, actually. One of my friends' family members were like, how are you a Raiders fan? But it's funny. I guess to each is their own, right? How do you like Tom Brady now? You still a fan? You still like him? Rich Gannon, what a throwback. Oh, that be, Rich Gannon? Schmoopness. I do. I lived it and was trained. Never got my degree because the teacher was a ass and wouldn't let me use the real life experience as my second field. Really? I did not know that about you. Snoopy, we're learning things about you all the time. Who's that girl? Rich Gannon, wow. Smoopy smart. So Smoopy and that B, you guys are my wrenches, and I appreciate you guys. I really do. Yeah, I still like him. He was my first quarterback love. Yeah. Who was mine? Who did I like? You know what? My first love for a celebrity, it was John Stamos, Blackie Parish from General Hospital. Loved him. And I was recently going through all my old stuff down in my basement, my parents' basement, and I have the whole photo book of John Stamos. I love John Stamos. Pictures, everything. I just knew everything about him. Or I'm completely mentally insane. No. Rick Springfield. Do you remember when he played Dr. Noah Drake? Do you remember that? No. Yeah. Dr. Noah Drake. And he was married to Bobby Spencer. Poor Jacqueline Zeman. I loved them. Dude was a powerhouse. You're talking about Gannon, right? Yeah, my dad would always go, damn it, Gannon. It's funny. Have mercy. Yeah, he was Uncle Jesse on Full House and then Fuller House. But I liked him before he was Uncle Jesse. I liked him when he was Blackie Parish. I don't even think he was on there. I think he went to jail and then never came back. You know how the soap operas are so funny? Somebody they'd go upstairs and then they'd come down and they're 25. They'd be 5 years old. They'd go upstairs for a nap. Next thing you know, they recast and the kid's 30. Good old soap operas, right? Blackie, yep. Blackie and Miss H, yep. Schmoop, I will show you. Actually, I'll show it to everybody at some point. I'll get my photo album. I couldn't believe it. I was so glad. Kayla Jones is a big Johnny Depp fan. Oh, for life, probably bigger than Johnny Depp. Yeah. Yeah, he's it's some good choices there, kid. He's cute. Willy Wonka did it for you. Well, if I'm being honest. Yeah, he does look good. He's cute. But there was just something about when he first came on the scene. He was young. He was I think he was at 19 or 20. And then remember Demi Moore was Jackie Templeton. Do you guys remember this? Jackie Templeton, Demi Moore. She was a reporter or a photographer or something. So funny. His daughter is a great actress. Whose daughter? John Stamos? Or Gannon? Or Willy Wonka? Who are we talking about, that be? Do we know? Watch The Idol if you haven't yet. Ignore this weekend's acting skills, though. Whose daughter? I don't know whose daughter you're talking about. Oh, Lily Rose Depp. Oh, did you know that, Kayla? that your stepdaughter, your future stepdaughter, is on American Idol or The Idol? General Hospital days, huh? Nothing like it. Luke and Laura's wedding, me and my sister would run off the school bus, get a snack, and plonk right down on the floor with a big screen TV that had like 4 channels, and my whole family, we'd watch it. The Ice Princess. I still need to watch Nosferatu. I never heard of that, Michelle. Huh. Great singer, huh? All right, that's good to know. Stepdaughter, okay. Oh yeah, Johnny's stepdaughter is a singer. And I gotta look. Where have I been? I think I've just been having some heat stroke. Anyone see the Odyssey yet? Maybe. Amber Heard, yeah, that was a weird trial, huh? Talk about a shit show. My sister-in-law is still watching General Hospital. I didn't know it was still. It is on, but the thing is now it's so. Sonny's still there, Sonny Corinthos, but so many of them have passed away. It's so sad. Monica, Tristan, Robert Scorpio, Luke. Gosh, even Nicholas Cassadine, Tyler Baker. So many people have passed away. It's so sad. But I like the old intro when it had the ambulance and it would go up the driveway and I had General Hospital. It was like, do you guys remember that? Yeah, that was my horn. That was the best intro. I haven't seen the Odyssey yet, but it's on my list. Is it scary? Is it scary? I like scary. Schmoopy, I wonder if I saw that. Maybe. There's a link. I probably won't click that. Okay, you guys, I can't do the raid, and I'm sorry. Gen X, all right. Kim, no, not at all. So, Sonny, he is so cute, handsome. Another one with the dimples. Imagine if he came on my screen, I would literally pass out. Never know. He does have a show on mental health, actually, called State of Mind on YouTube. Sonny, thank you, Father. Okay, guys. Well, I'm going to end the show. Thank you all for being here. All my new people in the chat. I appreciate your time and coming over and hanging out. I'll let you know about if you want to follow along the 4 agreements. I'll put a thumbnail up. I just have to kind of figure out what day. And usually Monday nights at 6:30 for sure. So if anybody wants to leave and go over to Julie, Bay Harbor Beauty, I'm going to head over there in a minute as soon as I finish up these chats. My grandma watched Young and the Restless as the world turns, Guiding Light and Bolden. Yeah, my mom would switch over to those too. Good memories, huh, Kayla? Kristen, excuse me. Don't you dare leave yet. I saw your text. Settle right down for a minute. Are you one of Julie's mods? Do you have to leave? Kirsten lurking. I love her. Kristen, you just got to say one sentence to me and I laugh. You could say, hey, I like your double chins, and I'd laugh. I don't know what it is. Just crack me up. Thank you, everyone, for joining. Yes. You have a cool grandma. Woof. Kristen's in trouble. All right, so Kristen, you're probably going over to Julie's, which is good. So why don't we all head over there together? Have a good night. And if you don't want to go, obviously you don't have to, but I think you'll enjoy it. Oh, Smoopy, I got to gong Smoopy out or she won't be my Wrenchy anymore. Let's see, Smoopy. Karen Black, is that you? That's okay. You can go back. It was a really good one with Dr. Trae. And we ended up talking about Lindsay Clancy and postpartum depression. So it was just insightful to listen to her views. I love her train. I love the way she thinks. Smoopy, this is for you. How do you like that? Karen, I'm sorry you missed it. That's okay. Usually Monday nights at 6:30. I am going to do the second agreement one day this week because I'm doing the 4 agreements. It's either tomorrow night or Thursday. I have to decide. So I appreciate you being here, Karen. It's okay. I know where you are, and I know you're hot, right? Because it's humid. You're not too far away from me. So stay cool. If I had a pool, I'd jump in it. But as we know, I don't have a pool. All right, you guys. Thank you, Schmoop. Thank you, Karen. Thank you, Kayla, everyone that was here. I appreciate you. We're going to head over to Julie's. I can't do a raid because I don't have enough subs, but that's okay. Hey, guys. Good night. Thank you so much. Well, that's okay, Karen. I appreciate you just coming in and saying hi. I really do. Maybe I'll see you over at Bay Harbor. Thank you, guys. I'm going to end it. Take care. Stay cool. Stay